Hey there. In this video, let's talk about pain and where it's coming from. Hey there, welcome back. This is Elbu, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. Right. I know very commonly people will try to search for pain around the knee. Where is it? Whether it's at the front, whether it's on the side, whether it's on the medial side, the lateral side, whether it's on the front, whether it's below the kneecap, whether it's above the kneecap. There are more than things that you should look out for. Alright, knowing where the pain is can only tell you so much because there's a lot more things to it. It can be a bit more complicated than you think. So let's just go straight into this topic and let you understand with the help of also the 3D model and some of the examples and some of the patients that I have seen so that you understand this situation better. Alright, so we're just going to dive right in and to understand where the pain actually comes from. Okay, so in general, right, pain can come from things around the joint. It could be the ligaments, right? So over here, example, the knee, we can have the ACL, the PCL, the LCL, the MCL, right? So all these ligaments can have can get themselves into trouble depending on what had happened, right? And then we have the individual muscles and the tendon, right? We have to look at the muscles and the tendon as one unit, all right? So basically the difference between a ligament and a tendon is that a ligament basically holds a bone and a bone together, and the muscle basically, the tendon basically starts as a tendon and then it functions as a muscle and then it is attached to another part of a bone or another piece of bone. So basically when the muscle shortens, you are able to move, right? Ligaments are basically there to hold it in place. It doesn't help you in any movement. Right, so that's the key difference between muscle, tendon, and ligament. Right, so muscle can also contribute to the pain around the area. So over here, I'm not gonna name all of them, but basically you have your quadriceps muscles in front, you have your adductor muscles on the side, on this side as well, and then you have your hamstring group muscles at the back. Okay, you also have your calf muscles over here. Right, so these muscles and nerve can contribute to the pain as well. Right, so I'm not going to name again all of the nerve, but basically all you have to know is that around the knee area there are different nerves running in different areas that can contribute to the pain around the knee. Okay, and then we also have something what we call the referred pain. Basically what this means over here is that you may be feeling pain on one particular area, but that doesn't necessarily means that the source of the pain is actually where you're feeling. Alright, so that's what we call referred pain. And then we have others. So we have the postural. Basically, if you put yourself in a specific position, you may tend to load the muscles in a very funny manner, right? So overloading then becomes a problem because of the posture, right? So we also have compensation, kind of linked to posture as well. Basically, all three of them can be linked in a sense, right? So compensation is because once you put yourself in a particular position, how you function, how you make the muscle work, how you make your joint work, it's very different now, right? And because of the change, then you are actually making certain muscles work more, right? So once that happens, you tend to load, you feel pain, then you may start to shift your body in a certain position to not feel pain. That's compensation. Okay, so first you have no pain, but because you work in a certain manner, and then after that you shift yourself so that you won't feel the pain, but then you're loading on a different part of your body. Okay, so that's compensation. Mechanical, basically, we usually term this as biomechanical. Bio basically just puts your body into consideration, but in a mechanical sense. So those of you who have studied anything to do with mechanical, you know that certain movement or in terms of engineering perspective, there is a certain way to minimize the effort of a body if you put yourself in a certain position. And the same is true. Your body requires more effort to do certain things when you put yourself in a certain position. Okay, so basically that's biomechanical. Right? So that's why I say all three of them can be linked together as well. Right? So things that you can do if it's first time and you're trying to figure out what's happening, sometimes it may be just a simple strain, and then it causes inflammation, or the muscle is just overworked, or that you're just sensitive around the area. And so when you visit a GP, a doctor, that's the first thing that they usually get you to do, right? They will prescribe you painkiller, anti-inflammatory, muscle relaxant, and to help you relieve the nerve, right? So those are the medicines that you usually get. But if it's persistent and if it's recurring, you may want to consider looking for a professional's help, because if not, then you are actually stuck at step one, right? You keep taking all this, and you know that it keeps coming back. It doesn't go away. Then it's not just a one-time. Something else may be happening that's contributing to the pain. And if you just keep taking this, the condition can get worse over time, because you just keep loading it and you just allow it to be worse, right? Basically, you are doing this stuck at step one. It's just numbing everything, and you're just trying to get a quick fix. When it comes to our body, sometimes there's no quick fix. You really have to get to the root of the problem, so that then you can fix everything. And this requires somebody to assess you, to understand what's happening, so that you can get yourself out of this rabbit hole, right? Alright, so back to the 3D model. Let me just show you what's around the knee. All these are possible. If you have pain on a certain area, these structures around the knee can contribute to it. Okay, so if you're feeling pain around the kneecap, if it's above, it could be contributed by your quadriceps muscle. So quadriceps meaning there are 4 of them. It could be this muscle. Okay, in short we call it VL. There is your rectus femoris, there is your vastus medialis, and then there is another guy that's just sitting behind, the 4th one, and this is called your vastus intermedialis. Okay, over here. Right, so these are your quads muscle. And then tendon itself, very commonly you will also hear people talking about tendonitis, inflammation, and yes, that could happen. Below the kneecap, there we have the patellar ligament. Alright, so this area can be painful as well, right? And then we have the sides of the knee. Okay, so on the side, we have our adductor group muscle, right? So all this that is running from the side, that is going to the side, can contribute to pain around the side. Alright, so those are the muscles, those are your adductor group muscles. And then we also have the lateral side, right? So lateral side can be contributed by your commonly known the ITB, alright, ITB syndrome. This can be contributed, and people can feel the pain on this side. And on the back of the knee, there is your hamstring group muscles, alright? So basically, your bicep femoris, okay, the long and the short, alright? We have your semi-tendinosis, we have your semi-membranosus, alright? So all this can contribute to the pain over here. And then something not to miss out is also your calf muscles, right? So these are your gastroc muscles, right? There's also another muscle that is just hiding behind, that is very small, over here. This is your popliteus muscle, can contribute as well. All right, so all these muscles are those that can contribute to the problem around the knee. All right, so then of course we talk about muscles, tendons, they are the same unit, right? And then we have all these other structures. All right, so all these whitish structures, they're mainly the capsule. They are very similar to our ligament. It's just that it's wrapped around the knee, and this can contribute as well. Okay, and then if we were to go deeper, then we have your meniscus. Sorry, over here, right? This whitish area, basically your meniscus, and then the cartilage. Basically, it's just sitting above the meniscus, but you can't see it over here, right? But they basically are just very close in the structures that can affect the pain that you have, right? And then we also have the ligaments. So the ligaments are your ACL, right? Your PCL, your LCL, your MCL. These are the ligaments that can contribute to it, right? And then once we remove all these tissues, then next thing we have your bones, right? So all these bone structures can also contribute to the pain on whichever side that you were researching, right? So bone itself could be, some could be have some patients have hairline cracks, or some patients have very micro fracture. So these are things that can happen on the bone itself. All right, and then we also have this wires running around. I call them wires. Basically, these are your nerves, right? So they basically run around the body, and over here we're talking about the knee, and you can see that it basically just runs around like that, right? There are many different names to it. I call them wires because the function of the nerve, basically it's there to send signal to your brain and to receive information or signal from your brain, right? It is not so easy to get nerve damage unless you have some accident, you get cut. It's not that simple to get nerve damage. The problem with, or the thing about people having a sensitive feeling that is sending to your brain or sending from your brain is because the nerve's main job is actually to receive information and to sense information. And that's why when people are sensitive, they do feel different sensation, right? Not that the nerve has got problem. It's basically the nerve doing its job to let you know that something is not right. Okay, so for example, if you hit yourself on the table, you feel pain, right? And that's basically your brain picking up the signal from that part of the body. That's simply it. But the nerve can be complicated. Some of the feelings that people feel could be burning sensation, could be tingling sensation, could be pain, could be referred pain somewhere else, running along where the nerve is. Yeah, so these are some of the more common symptoms and feelings if the nerve is involved. It doesn't necessarily mean the nerve is damaged or has got something wrong. So even if you take medicine to relieve the nerve sensation or the sensitivity, the problem is still there. It's just that you're not feeling it. Once the medicine wears off, the thing may come back again, right? So because the nerve is working normally again and it's picking signal again, so you don't want to chop off the signal because that is critical in understanding the issue, right? It's almost not possible for people who are not in this field to understand and to figure out what is actually going on because you're not trained in this line, right? So it's good to seek professional help, and it's good to do your research because it's good to question professionals as well, because then you understand where they are coming from, and whether things are taken consideration to some of the things that you are complaining or you are mentioning when you are going through your consultation. Okay, so these are the structures that I want to show you over here. All of them can contribute to the pain around the knee, but sometimes it's not so simple. It may be more complicated than you think because there are more things to just the structure itself. All right. Now, patients can come in with knee pain, but they present themselves with different issues. All right. So, for example, I can have 5 patients who can come and tell me that they have knee pain over here. Okay, so if we just want to look at what's around over here, it's basically the ligament that's holding your patella and your tibia bone. Okay, and there's really nothing much. But although I acknowledge that yes, the pain may be here, we also got to look at different things, and different things tells us different condition and how they can all contribute to the pain, right? So let's just take this as an example, yeah, pain over here, but there are different things that I see in a patient, right? So for this case, we can actually see that the patella is actually in a different position. Okay, the reason why I use a marker to draw this is also because to let the patient see, because most of the time they can't tell, right? It's only when they're rested and not doing anything, then you can assess this and see this, right? So then I can also have patients coming in with a different size in the leg. All right, whether you're looking at from the back or whether you're looking at the front, same thing, right? The pain can be here, but this time round, they're coming in with a different condition, right? The muscle has already atrophy, right? It's smaller size compared to the other side, right? Very similar case over here, and same thing over here, different size. Sometimes not so obvious. It's very hard for somebody who is not professional to tell the difference, but yeah, that's what we do, right? Another one, different muscle size. And then sometimes we can have people coming in that presents themselves like that, right? You know that there's something wrong, right? They can have knee pain and then they just look different, right? So for this case, if I'm not wrong, if I remember correctly, there's something wrong with the hip, and from the hip down, everything is just tilted to one side. So the leg doesn't quite function in that manner that we would want to, and hence you're loading the knee or the muscles or the structure around this area in a different manner, Okay, so some can be internally rotated, right? Different leg. Some can be externally rotated. Okay, so yeah, just different case. So you can tell that not just looking at the knee. I do acknowledge that there's something wrong with the knee, but there's more to that. Okay, so I can also have patient coming in like that. Basically, this is actually the same patient. So coming in like that, and then we got to try to fix him such that he can move on to this second picture and then to this third picture. Okay, so yes, the knee can be the pain can be on the same area, but everybody can come in with different scenario, different case, right? And this same patient, he is a runner, and it's giving him a very special problem because of how he is already in this position. The way he runs is just very different from how he should run. Okay, so we did a running gait test to make sure that this is what we think and this is what we see when he runs, right? So yes, same area that could be feeling the pain, but everyone has got a different scenario. So we do this, and we can't say that every pain that's in that area has similar problem or has the same problem. Okay, so we need to look at it in a more holistic way. We need to assess the area, and not just the area. We also got to look at other contributing factor, right? All right. So that's basically what can happen around what you're feeling. If you have pain, it doesn't necessarily means that that area has got problem. There may be more to that. Could be somewhere else, something else. Unless you do a proper check and a proper assessment, you wouldn't know what can happen or what is already happening. Alright, so that's all I have for you in this video. If you have any questions, please post them in the comment section below, and I'll see you around. Please take care.